Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. And now your host, Dr. Joe.
Well, good evening, everyone. This is Dr. Joseph Kanu, and we have our wonderful guest tonight, Dr. Jeffrey Haddad. Welcome to the show, Jeff.
Thanks, Joe.
Yeah.
Good to be here. Another Wednesday.
Another Wednesday.
They come up so quick.
I know. The show goes by quick, and these come up quick.
It's true.
But, hey, I'd like to start the show tonight with a scripture reading from Isaiah chapter 58, verse 8. Then let your light will break out like the dawn, and your recovery will be speedy and spring forth. And your righteousness will go before you. The glory of the Lord will be your rear guard. Then you will call, and the Lord will answer. You will cry, and he will say, Here I am. If you remove the yoke from your midst, the pointing of the finger and speaking wickedness, and if you give yourself to the hungry and satisfy the desire of the afflicted, then your light will rise in the darkness, and your gloom will become like midday. Amen.
Amen.
To that. Okay, so this show, we're going to talk about dental issues. We have Dr. Jeffrey Haddad of Rochester Advanced Dentistry. Jeff is definitely a mouth doctor, not just a dentist, not just a cavity filler, which we need.
Mm-hmm. Yeah,
but I really appreciate all the extra training and your continued training and seminars you go to and all the advanced equipment that you have.
We never stop learning,
Yeah.
And I think that's true in any business or occupation or anything. But I love
the
it.
Job fun.
It does. I'm doing things today that I wasn't even doing a couple years ago, and it's interesting that a lot of patients and people out there aren't educated on the latest in dental technologies and techniques, and why should they be? Really, it's our job to educate them, and that's really what I love to do in my office. We want them to know that we have this new piece of technology, or we want them to know that there may be another option for them to have, say, a beautiful smile, or to replace a tooth that they lost many years ago.
Sure.
With dental implants, which we've talked about before.
Yeah.
It's interesting. I think timing is everything, and coincidentally, speaking of dental issues, Dr. Haddad had a dental issue today.
Wow.
Yes, I was in the chair, people, and it was.
Can I say something? Physician, heal thyself.
Yes.
That has slapped us in the face a few times.
I'll tell you, God bless my partner, Dr. Doolin, because I couldn't have done it myself. But yeah, I had a very common thing. Over the weekend, I started having what I call a food trap. And maybe
a food trap.
A food trap, meaning
that?
every time I ate something, I would get something caught in that area, which wasn't happening before.
Right.
So obviously something changed. I didn't know what. I was kind of afraid because my brain works overtime. And I'm thinking, do I have a big cavity? What's going on? Well, what happened was because I'm a pretty big grinder and I wear my bite guard religiously, doesn't stop the destruction. And so I actually sheared off a little bit of a filling.
Oh boy.
And
well, we talked about that last week.
That's why it's so ironic, and it's interesting. We're going to be talking today. We'll do a little recap from last week.
Let's do that.
Okay, because
so last week
we talked about the CIRAC machine, which is a computer-based CAD/CAM system that actually designs a crown, or what we talked about, an onlay, which is a porcelain puzzle piece, right there in the chair. You can have a crown in one day, and an onlay in one day, and you're restoring the tooth back to its natural form. You're not putting a big old silver filling in that wedges the tooth apart or causes these micro fractures and things that we don't want to even consider. We're putting a piece of porcelain in that's adhesively bonded to the tooth and overall reinforces the entire tooth, which
so
is
it
what we
actually
want.
strengthens.
It actually strengthens.
Wow,
You're not
that's
putting
great.
a foreign object into the tooth. You're actually restoring it to its whole, part again. And so I took a hat.
This is an alternative to doing a whole crown.
That's correct. And actually, or an alternative, or if a crown's necessary, a crown's necessary. If you've broken off a very large portion of the tooth, the only choice we have is a crown. But I'm going to tell you, a lot of times, dentists, because they're not trained to make these onlays or to use the technology like the CEREC, they are forced to do a crown. So that's where I feel that it's my job to learn the best for my patients.
Right.
If I wasn't, then I'd be cutting down a lot of good tooth structure. And that's what happens. You break off a portion of a tooth. Do you have to cut down a bunch of good tooth structure to restore it? No, you don't. And, thank God that my partner is trained like I am, because my tooth, if I would have went to several dental offices, I would have needed a crown. He was able to conservatively restore it. In between patients today was kind of
wow.
It was kind of fun for me to
this
go
done today
during the work day.
That's
and
amazing. We did talk about this last week.
Yeah, I mean it's a complete coincidence, and my patients. Obviously, they laughed at me when I came in and, was essentially stumbling over my words because I was very numb. But I told them that today I was even more empathetic to their position, I guess, because it's kind of nice to be reminded of what you do to people every once in a while. And I got to be honest, I don't love what I have to do to people. It's a necessary evil at times, but I was very, very numb and got the work done, and I feel great now, and that's the nice thing about what we can do. We can fix a problem in one day. And there's my recap from last week. It involved me, and it's amazing technology.
I loved last show when you talked about if you have a cavity, you need to have it drilled and filled, but if it's cracked, you were talking about the cusp.
Right.
That your tooth has 4 cusps.
Correct. 3 to 4 cusps. Yep.
And then if you break one off, like from amalgam fillings.
Correct.
Instead of needing a crown, if that there's this in-between phase.
Correct.
Where you would normally do a crown, if it's not too severe, you have the CEREC machine.
Correct.
Where you can blow up the tooth the size of
your head.
The size of your head, and see all the detail.
Everything.
And then this machine does this like a lathe work, right?
Correct. Yeah.
Is that what it is? It's
milled out. Yep, it's milled out, and all our engineers out there are sitting there going, yeah, CNC, it's CAD. I know that.
Right.
That's what we do, and it is. It's the same technology. So it's a great service for our patients, because a patient comes in with a broken tooth, we can fix it that day permanently. They don't have to leave with temporaries. They don't have to, go and I've had temporaries before. They're not fun. They're sensitive. They're uncomfortable to chew with. They are, they have the possibility of falling out and have to go back to the dentist. So it's a nice option. And, for those of you who, are interested in things of that nature, I have a lot of stuff. I always talk about my website. It's my baby, RochesterAdvancedDentistry.com, or you can call our office, 248-656-2020. This is the type of dental work that is possible, and that's why this radio show is so great. We get to educate people and what's out there.
Jeff, what was a real eye-opener for me just recently in the last month or so was all the diseases. I knew that some of the cardiac diseases start in your mouth, but all the and when you're pregnant, if you have periodontal disease, how prevalent that the low birth weight and
correct.
And so many health issues. But so we talked about mercury amalgam, we've talked about crowns and inlays and what else do you have to tell us?
Well, what I want to talk about today, and I know I think it's going to strike a nerve, because I know you don't love the cosmetic stuff. I know you don't love the cosmetic stuff. I'm going to make you a believer, Joe, one of these days. I'm going to tell you. Well, we had a great show a few weeks ago.
Not that I don't like cosmetics, but you've had so many other more interesting things.
It's fair. Well, I'm going to make this interesting for you. How about that?
Okay.
All right.
That's going to take
fair?
some doing.
I'm ready. I'm ready. I'm accepting the challenge. hours.
Okay, hey, can I just throw our number out?
Absolutely.
If anybody has any dental questions and wants to talk with Dr. Haddad, you can call the station at 313-838-1035. That's 313-838-1035. Okay, so you're going to prove to me cosmetics is interesting.
Well, a few weeks ago, we talked about what I call life-changing dentistry, right? And I told you some very touching stories,
Great
right?
stories.
People crying in the chair after we gave them the smile of their dreams. And that is the type of work we do weekly, and it's fun. It's a fun thing for me to do because patients appreciate it. They truly have a new look on life. They're not smiling with their hands over their mouths or not smiling while showing their teeth. I can tell you right now, anybody who smiles with their teeth not showing is self-conscious about their teeth.
Yeah.
Nobody naturally smiles like that. Okay, if you're laughing, you don't smile. You don't laugh like this. Okay, you can't. Okay, your mouth opens. You're hiding it.
Yeah.
And so, what I want to talk about today is hands down the most conservative and probably one of the most popular, if not the most popular, cosmetic improvement option we have in dentistry, and that's teeth whitening. Obviously you're familiar with it. A lot of people have heard of it. I mean, it's all over the news, and there's over-the-counter products. I mean, we're just inundated with, maybe too many products, too much information. And what I want to do today is just talk about some main questions that I hear on a daily basis. Are the over-the-counter are they good? Are any of these whitening products, are they safe? Do they harm your teeth?
Right.
There's a lot of these questions out there.
You know what a stickler we are on, like immunization shots that have aluminum, mercury, MSG.
Right.
The high fructose corn syrup,
of course,
or any of the natural, or the artificial sweeteners, even table salt. We've been talking about table salt recently and how much better sea salt is. Just table salt, they heat it to 1,200 degrees, and they strip all the minerals out of it. And so I'm going to really be hard on. I want to know what is in the whitening.
That's perfect. No, I mean, I think that, that's that's a very valid question. And I know that there are a lot of, and today's society is really starting to embrace organic stuff and more holistic views, which is great. And honestly, this really falls within, I think, a lot of, unless you're really extreme about not putting any type of substances, on your body, in your body, well, this falls within that. This is not systemic. This is just topical. This is hydrogen peroxide, forms of hydrogen peroxide, which is a very stable,
is that a food grade hydrogen peroxide?
Correct. And so this is a
hey, for the listeners out there, I'd like to say, so we're starting with hydrogen peroxide,
right?
Which is, water is H2O, hydrogen peroxide is H2O2.
Correct.
It's just basically water in an unstable state, and it effervesces and can kill bacteria and so it's very safe, and you can drink hydrogen peroxide if it's a food grade. You don't want to go to the drugstore and just buy hydrogen peroxide.
No.
That is not food grade.
And that does not taste very good.
And it doesn't taste good. Don't drink that. But there is food grade that you can get at health stores.
Yeah, this is not.
So this is starting out with that.
Well, this is not meant for ingestion anyway. And so that actually, but you're segueing into a really good point. A lot of people ask, what's the difference between over-the-counter and in-office drugs? As far as that goes, as far as, teeth whitening goes. And there is a big difference. The two main are the strengths of the solutions.
Strength, okay.
And the trays that they're delivered in, okay?
That's important.
All right, and so, we have in our office, we're talking about custom trays, okay? These are very accurate, intimately designed trays based on impressions made of your mouth. They're very tight fitting, and no solution gets out of there. Unfortunately, a lot of the over-the-counter type drugs, it isn't good. It's made for all. So they're a little sloppy.
Right.
Things can get on gum tissue. Some of the side effects of this can be a little chemical burn from these things, So those are a couple of things to start off with as far as that goes, and you want to decide what your goals are.
Right. Hey, Doc, we have a couple of callers on the phone.
Okay, great.
Can we go to
Absolutely.
number one, Robert? Hi, Robert. You're on the air.
How are you today?
Hey, wonderful.
Good evening, Robert.
Thank you for calling. What is your question for Dr. Haddad?
Well, a number of years ago, I had my two front teeth, as I've been brought up all my life, being called Bucky Beaver because my two front teeth are really protruding.
People are cruel.
Well, I gotten tough over the years, but what I did was I had a white spot on the tooth that my dentist told me years ago that I must have bumped it when I was a child while it was still a baby tooth, so it had a white calcium deposit. So since that time, I had porcelain veneers installed over top of it and covered it. But they have now since yellowed very, very badly. And I don't know what to do. Everybody says that porcelain veneers should not yellow, and they just want to put another coating over top of it. Well, as I said, my teeth are very protruding in the front, and if they put more coating over top of it, they're just going to look more bulky. What's my option?
Robert, I can tell you right now, I haven't seen you, but from what you're describing, this is not a porcelain veneer that you have on. This is a composite veneer, and there's a big difference. This is a true – did your dentist ever refer to it as bonding, something along those lines? Because a true porcelain veneer will not pick up stain. It can't. It's not porous at all. And, I do porcelain veneers on many of my patients. And again, it's a great service, and we've told Dr. Joe that, this does change lives. We're trying to make him a believer, and it really does. It actually encourages bad habits because you can't pick up the stain. You can't pick up your coffee stain. You can't pick up your red wine stain. But, Robert, what you have, if they're talking about putting another layer on, that means that they're bonding composite on there. And composite does stain. It's very porous. It's not a bad material. It's just not as strong as porcelain. And, again, it does stain. So my recommendation to you would be to, find a dentist or ask your dentist about the materials that he's using, because it sounds to me that you're getting a different option. Even though the word veneers being used, the material is very, very important, because I can promise you, no porcelain made in dentistry picks up stain, but composite, which is a plastic, picks up all the stain in the world, okay?
Well,
so I hope that answers your question. Yeah. And I'm going to tell you one more thing, Robert. If you have that protruding, Bucky Beaver look, quote unquote, having a true porcelain veneer done is actually thinner, and the tooth can be shaped, and it can be shaped and brought back so that it will not be protruding at all. I've done that for so many patients. It makes a world of difference.
Wow.
I hope that answers your question.
Well, it does, very much so, but can the composites be taken off and then porcelain?
Absolutely. Absolutely. Absolutely.
Yeah.
In fact, it's actually a very good segue into a porcelain veneer. You've had the composite veneers. They obviously made a difference for you. You were happy at one time, but now you need to go to that next level. And absolutely, that does not prevent anything. We remove the composite. We shape the tooth as if the composite wasn't even there, and we place the porcelain veneers. So, yep, it's not a problem at all.
Well, great. Hey, Robert, does that satisfy you so far?
Robert, I'm not sure what area you're calling from, but again, we do a lot of this work. Our website is very educational. In fact, it even talks the difference between porcelain veneers and bonding. So if you have the chance, go to RochesterAdvancedDentistry.com, or you can call our office at 248-656-2020 for a consultation, and we sit down. I take photos of every area and angle you can think of. We sit there and we look at your teeth up on a big screen, and you show me what you don't like about your smile, and I tell you the different options. It's very educational. Information is power here, and so I do that with a lot of patients. I would recommend that, whether it be at our office or another office, at least finding out your options.
Yeah.
Thank you for the call.
Thanks for calling in, Robert. Okay, so now we do have another caller, Belinda. Hi, Belinda.
Hello.
Belinda, you're on the air.
Hi, Belinda.
So what is your problem?
My question is, I have veneers, but as I heard you explaining to the other caller, I don't know what type of veneers. I've had them for probably about 8 years, and it looks like one is cracked, and they're my two front teeth. And mine too, I think I've noticed over the years that it has kind of darkened, or it's not as bright as it used to be. And what would you do to correct the crack? I mean, I'm thinking you probably answered my question with the previous caller, but.
Well, no, that's a good question. If it's a porcelain veneer, first of all, and there is a crack, sometimes it can be a hairline crack, almost like good china. Okay, we have good, nice china, and you see these little hairline fractures. The plate's not going to break, but you see the little blemish there. Okay, and to be honest, I was taught that even if I see a little crack in a brand new veneer, that you bond it in because it's as strong as anything, and that adhesive process corrects that. Now, obviously, if it's unsightly, we don't do that, but these are micro, little fractures. But again, now that you're talking about, now let's say hypothetically that is the case. It is a crack and it is affected. The only way to fix that, though, is to replace the veneer. You take that veneer off, we take a new impression and we make a new one. Now, if they have changed color, though, again, I go back to everything that I know about a true porcelain veneer, it should not be changing color. So then I question, is this a composite or a plastic bonding type veneer or porcelain? And that's if it's not a porcelain one, it's a composite that we talked about, a little crack, they can amend that. I mean, that's a very easy thing. You can add on to composite. That's actually one advantage to this. You can add on. You don't have to have the whole thing taken off. Unfortunately, back to the staining issue, if they're not the color that you want or had or really are wishing for, then the only way to do it is to go to that next step and have a true porcelain veneer placed.
Okay.
Well, Belinda, yeah. Go ahead.
Oh, okay. You mentioned that you can come in for a consultation. I don't know if you get prices over the phone, but is there a charge for the initial consultation?
Actually, there is an initial charge, but we actually put that charge towards any work. So it's a very minimal charge, and it's but we place that towards any work. So what I never want anybody to come to my office and feel that they didn't ever get their money's worth. And so we came up with this office many years ago. It works very well because people say, all right, I'm coming here. Not only am I learning about things, but if I decide to do anything, I get to apply that towards whatever work I have done.
Okay.
And again, you can call our office. Our ladies are experts at just not only educating you, but finding ways to make it affordable for you because this stuff gets expensive, as you know. But again, our office number is 248-656-2020. Be happy to take a look at you, and we can just take a look at what your options are because there are lots of options in dentistry.
But Jeff, wouldn't you think for the front teeth that you would want the porcelain and not this?
I would, and it's very yes. The only time that I ever recommend
because it can crack and then it does stain and it's your front teeth.
Correct. I mean, there's a couple times that I'll use bonding and I'll recommend it. One is if you have a little chip on a tooth. Well, again, back to the crown versus the onlay thing. I'm not going to remove good tooth structure to put a veneer on there, okay?
Right.
So I'll use some bonding in a very limited fashion, and yes, I tell them it's not going to last forever. I know it's going to stain, but it's so conservative. Let's stay conservative. I'm going to make it look good for many years, and when it starts to discolor, well, we'll do it again, and that's fine, and it's going to save you money and tooth structure. But the other time is young children. When you have a young child who has an accident, they're not done growing. You don't even know what their smiles are going to be. And at that point, I would not feel comfortable putting an expensive porcelain veneer on a child or a teenager when I don't even know what their mouth's going to look like in the next 5 years. So, again, I'll put some bonding on there. It'll get them through their teenage years till when they are fully matured. And then I'll say, you know what, it's time. And then we'll do something a little bit more permanent.
Right.
Okay.
Hey, Belinda, do you listen to the show very often?
Oh, all the time.
Do you?
All the time.
She's one of our listeners.
It's great.
Yeah.
Well, it's great to have you. Thank
Belinda,
you for the call.
if you come in to see Dr. Haddad, Jeff, I'm going to cover her first visit.
Wow.
Okay?
Look at
I'm
that,
feeling
Belinda.
generous.
Look, I love it.
Okay?
You are.
Belinda, but I want you to come in. Yeah, why don't you do? I'll cover her first
That's
visit.
great.
Okay?
Wow, that is great,
And Belinda,
Dr. Joe.
come in, check it out. Just the first visit.
Yep. No,
But then I want you to call back on the air and let us know
about the experience. That'd
how
be great.
nice Jeff treated you, Jeff.
Oh, boy.
You better be on best behavior.
I will do my very
All right.
best. No, that's great. What a good guy.
Hey, God bless you, Belinda. Thank you for calling in. Hey, we have one last caller.
Okay.
You think we have time?
Yeah, let's do it.
We only have about 30 seconds.
All right, let's do it quick.
Carla, you are live and on the air.
Good evening, doctors.
Hey, hi, Carla.
Carla, how are you?
I'm going to try to make it quick. I just want to know, after we get all this work done, have you ever heard of something called a sealant?
Yes, I have.
Sealant, yeah.
Are those safe, and will they, preserve our work we did?
Actually, no. Well, sealants they're very safe, first of all. Very safe. And actually, sealants are not meant to preserve work. They're meant to preserve the chewing surfaces of teeth. And really, sealants are meant for children and young teenagers, really just to fill in the grooves of their teeth, to kind of get them past that bad stage where kids are not taking good care of their teeth. We want them to brush their teeth. We want them to take good care, but they're not brushing their teeth as much as they could. And so as an adult, if you've already had dental work done on a tooth, a sealant is not necessary at all, and it won't help at all. So a sealant's a very good thing on a what I would call a virgin tooth that has no work. It has some deep grooves in the chewing surface. We use a sealant it's a plastic material, very safe, and we literally just fill in that groove so that food and other debris can't get caught in there and cause cavities. And it's really meant more for children and young teenagers. Does that answer your question, Carla?
Yeah.
Man, but that was a great question. We should talk more about sealants.
We can do a whole show on sealants.
Show.
Sealants have changed dentistry.
That's a good future topic.
If I had sealants, Dr. Joe, in my mouth, I wouldn't be having all the dental work that I have.
Yeah.
I just missed that sealants wave.
Wow.
It was after my time, but I'll tell you,
afterwards.
It's changed dentistry. So that would be a great show. Thank you for the idea, Carla.
Hey, so we've run out of time. We really didn't get to the cosmetics.
I think that was your plan.
Yeah, thank God. Hallelujah. We didn't thank you for the callers that got us past.
Although every one of those callers was about cosmetics, so I got a little bit of it, all right?
Yes.
We're going to talk about teeth whitening at an upcoming show because people want to know. I promise. Audience, I will win this battle.
So anyways, you can go to our website, simpletruthsforhealthyliving.com. Dr. Haddad's website link is on there. And remember that in all that we eat or drink or do all things to the glory of God. Good night and sleep well.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.